Okay, right, perfect. Thank you very much for attending this hospital meeting. This one is on Zoom, but after a few months we will do them in person as well. My name is Marcus Whitten. I'm the Programme Manager at the Royal College of Paediatrics and Child Health, and I'm going to pass on to our Regional Coordinator, Dr. Balaram Mishra, who will provide us with some opening remarks. Happy to? Perfect. Over to you, Balaram.
Okay. Thank you, Marcus, a lot. We have been working very hard for so long. All the team from the various hospitals, our champions, our team also have been working so hard, and we are happy that we have been already registered in SWC, and we have already started our program. We have been doing few works. There is some noise on the background. I don't know from where. So I think most of us are eager to start the program. We have already done our ETAT training to all the champions. Then we have been moving towards the Triage and our GLM. They have been working very hard, and they have been very wonderful in devising their own methods for their what do you call recordings. Few recordings also we are going to have right now in few days. And our most important part, modular training. Modular training will be the backbone of this program. So I think we have to concentrate on that. And before that, all our preparation has to be made. Especially there has been a lot of talk about what are the material that has to be given to those participants in modular training. And the modular training, if they don't have a booklet in their hand, they don't, in fact, have that much of interest, because if they are under training, they just want to see something what is in the content, what they have missed. They can go at home also, and they can just look into what they are doing right in the training. So I think one idea will be to give them at least 4 or 5 copies of the of our modules. The book should be given to them, number 1. Number 2, we start with our GLM, and our champions will be the trainer over there. And one thing we have to decide about how many participants should be included, because in smaller hospitals we will have less number of participants, and in bigger hospitals like Janakpur and Rajbiras and maybe in Birganj, we have a lot of participants. So we have to take care of that also, and how long we can continue this modular should be simultaneously, or maybe we can just break in. So we'll have to think about that also. And the reinforcement has to be done with our experts also, like from Kathmandu or maybe our province 2 pediatricians over here. So these are the things to be done, and we are right in time. We are not lagging behind. We have been working very hard. Things which we have not done previously, that is also being done. And I'm happy that Bindu will be going this afternoon in the immigration, and we are trying to fix that visa problem also. we have already talked to the medical council and nursing council. That also be done within this week. So I think with these words, I thank all our team members. Because of our teamwork, we are doing quite well, and will have very positive effect of our program. Thank you very much, Marcus.
Thank you very
Over
much.
to you, Marcus.
Thank you very much, Dr. Balaram, for your continued leadership, which I
There is some noise in the background. We should stop that noise. I don't know from where it is coming.
It's all sorted. I can multitask,
Okay.
not very often, but occasionally. Right,
Okay.
perfect. So thank you all very much. We've got a very short presentation, and I have to thank Leanne, who's on the call today, for doing the slides for this. We've got a very short presentation. GLMs, please feel free to jump in if I miss something or get it wrong. So yeah, so hopefully that will all help us along a little bit. So I'm going to share screens with you quickly, and we will go from there. Lovely. All right then, excellent. So this is a meeting. The most important message, really the only thing that I want you to remember, is that this is a team sport. So you are not on your own. We are all working together as one team. So it's really important to get that across before we start, because this is not an individual thing. This is a team sport. So you will all have gone on training courses before, which happen once, and then you are expected to go back to your hospital and do all of the things that you learnt in the training. We think that we would like to try something slightly different. And so we're doing this modular ETAT course with all of you, and all of you are helping us to deliver this course to your colleagues, to your doctors and nurses in each of the hospitals. We think, and the evidence backs us up, we think that delivering this in the hospital is much better. It means you don't have to travel. It means it's relevant to the work that you're doing, and it means that we can deliver it to more people more efficiently and more effectively, and make it really part of the work that you're doing in your hospitals. So we're following the same curriculum as an ETAT course that you would do over a few days, but we're breaking it up into little chunks of about 2.5 to 3 hours each. So not too long, not too short, and it's open to all staff. So paramedics, HAs, nurses, doctors, it's open to everyone who looks after children. And it's great to have a good mix. We think probably around 12 staff per training session is about right, but you can help discuss and decide that in your hospitals. We think that probably about 12 is about where you want to be, because we want it to be a practical course. You all have your mannequins, and you can all practice some of the things that we're wanting to do. So we think 12 is about right. It's very much not a lecture. It is group learning together. So everyone is learning together, and there's no pass and fail. So you don't have to pass and fail. There's no exam or anything like that. But you will receive a certificate of attendance once you've been to all 8 modules. So no pass and fail, because in real life there is no pass and fail. So there's no pass and fail, but we will give you a certificate of attendance when you've completed all 8 of the modules. And if you've trained on all 8 of the modules, you'll get a slightly different certificate, which indicates that you've been a trainer. Okay. Any other comments on that slide, folks, before I move on? Anything I've missed? No, I'll take silence as happy to move on. So where do we want this to be? Well, we want this to be somewhere that's relatively quiet. If you can manage a projector, then that's great. Don't worry if you can't. You can do it off a you can do it off a laptop or a tablet if you need to. We will make the participant handbooks available first on PDF and then for printing, but we will be quite careful with the printing, because as we update and develop this work, we might change various aspects of it. So the PDF will be the most up-to-date version. So please make sure that you are using the most up-to-date version. And that's why most of this will be on PDF online. Also, because printing is expensive, and we want to protect the environment and make sure we don't print thousands and thousands and thousands of pages. We will do MCQs just to help you assess the knowledge and make the session as relevant for you as possible. And we will provide you with money for refreshments for each staff member to attend. So there's enough money for refreshments. And we will ask you to fill in an attendance sheet so we know who has been to each of the courses. That attendance sheet we can do online. So the first one that we want to start with is triage. And the reason for that is because in our assessment that we've done so far, you have all told us that triage is a particular challenge for you. We also know that if you get triage right, you can reduce mortality substantially. And there is very good evidence that shows improving triage can improve the outcomes for children. So when we're thinking about this, we want to think about who are the staff who are going to do triaging. Can they prioritize? So can they move people, for example, to red areas or green areas? Where should they go within your hospital? It will be a bit different depending on which hospital you are. So the triage system in Janakpur will be a bit different to the triage system in Jaleshwar or in one of the other hospitals. But the principle is the same, that all children who arrive should be assessed quickly by somebody and should be placed in an area where they can be seen to in order of need. So not in terms of in order of time of arrival or in order of who is shouting the loudest, but in order of clinical need. And what we want to do is start with the training first and then look to implement changes in your triage system based on that. We're going to support to make sure that you have the equipment that you need and a documentation form to be kept in the hospital, not to go home with the patient. And we've got that form already designed, and some of you have helped us design that already. So it's nice and simple. And here it is. It's very straightforward and follows exactly the ETAT course that you all undertook earlier this year. So it's all there ready to go. And it has the emergency signs there ready for you, and the yellow and green signs if you need those. And it allows you space to write the temperature, pulse, and respiratory rate and record the conscious level as well. So very straightforward, not difficult at all. Shouldn't take very long to do. Sorry, before I move on, any further comments on this? Any further comments going on? Okay. We're going to audit to see how things are going. So we've been doing the dashboards with you, and we're very grateful to you for your support for the dashboards. And we're going to audit and see how things are going with each of these 10 focus areas that you identified as areas you wanted to way back in December. So this is our first one. This is triage here. So this is the first one that we're going to do. Once we've decided that we're going to do that, we know that we're going to do that, then we're going to use hospital improvement plans to really govern that process. And the GLMs and all of us will work together to help you with these. These are really just a way of understanding the things you'll need to change to improve the system. So in the case of triage, we need to think about the way that patients come into the hospital are assessed and categorized. so that we know that the right patients go to the right place. This will be better for you because it will mean that the system is not quite so, it means it's more structured. Quality improvement is a continuous cycle. And so we have to recognize that there are many different things that we have to do to improve this area of care. Hospital improvement plans help us to do that. And when we think about hospital improvement plans, you'll have seen this before. I think this was on the leadership course as well. The Fishbone Model. It's one of many models. It's a useful one because it shows us that it isn't just one thing that's going to make the difference. We have to pull lots of levers all at the same time, and possibly in the right order too. So we have to make sure the environment is good. We have to make sure everyone's got the right materials, that the methods and procedures are good, and that we're measuring their effect properly. We have to make sure that we've got the right equipment and the right people. All of that pushes us towards solving the problem. To support you as well, we're going to use quality support teams. And we're going to start those in July. And Simon, who's on the call, is going to come out to Nepal and help to launch those. And quality support teams are going to be made up of some of us from the UK and Ireland and some of you. And we'll do it together. And we will go and visit each of the hospitals together as a team. So it would be lovely, and we would be very pleased if you would come to join these quality support teams and visit another hospital to support them. The reason we want to do this is helping to build the network. This is helping to build the network of hospitals in Province 2, which we know is really important to the success of this program. So I'm now going to turn off the stop share, and I'll turn to others to make comments and to discuss. It's perfectly okay to discuss in Nepali. In fact, I would encourage it. You don't have to speak in English. If you'd like to speak in Nepali and discuss, that is absolutely fine. And in fact, I'd probably recommend it because it's important to make sure that everyone has exactly the right idea about what we're proposing. So don't let English hold you back. This is a Nepali program, so it's perfectly okay to discuss in Nepali. So maybe, Balaram, are you happy to do the question? So who would like to discuss? What we know is that there's always silence at the beginning, and then when the conversation gets going, it all gets a lot easier.
Yeah.
So who is brave? Who is going to be the brave first person who will discuss their thoughts?
Simon.
तपाईहरुलाई कसैलाई के गाह्रो भएको छ केही छलफल गर्नु छ भने गर्दा हुन्छ भन्नुभएको है. So I'm talking in Nepali, Marcus. Hope you won't mind.
You carry right on. No, please do.
No, it's because I think none of the staffs, whoever, have started talking. So let me break the ice, talking in Nepali so that they can get courage to speak.
Sure.
त्यही त फिल्डमा काम गर्दा हामीहरुलाई के कति गाह्रो भएको छ अथवा चाहिँ अहिले भर्खरै जे देखाइएको छ नि त्यसमा चाहिँ के चेन्ज गर्नुपर्ने हुन्छ अथवा तपाईहरुको के सुझाव हुन्छ त्यो चाहिँ भन्नुस् भनेर भन्नुभएको. English, Nepali, whatever you will. अहिले कले हाम्रो पिंकी सिस्टरले भन्न खोज्नु भएको थियो हो.
हजुर, पिंकी म्याम हजुरले के भन्न खोज्नु भएको थियो?
अहिलेसम्म क्लियरै छ. अब अस्ति पनि हाम्रोमा आउनु भएको थियो उहाँ दुईजना लुइस म्याम र हाम्रो लियानी म्याम. हामीलाई अलिक क्लियरै छ अहिलेसम्म. त्यही 10 जनासम्म म्याक्सिमम पार्टिसिपेन्ट राख्ने भन्नुभएको थियो अनि 2 देखि 3 घण्टाको सेसन चलाउने भन्ने कुरा गर्नुभएको थियो. इटाटबाट सुरु गर्ने अनि त्यो प्रिन्टिङहरु चाहिँ हामीले नै निकाल्नु पर्ने हो सर.
के
यसको प्रिन्टिङ चाहिँ हामीले नै निकाल्नु पर्ने हो.
प्रिन्टिङहरुको बारेमा मोडुलहरुको जुन ह्यान्डबुक छ नि त्यो त हामीले दिन्छौं. हामीले दिन्छौँ तर के एउटा नोइज छ कहीँको एउटा कहीँ ब्याकग्राउन्डमा नोइज छ प्लिज स्टप द्याट नोइज
मेरोबाट आइरहेको छैन सर
ठिकै छ केही छैन
सोनीजी हजुर प्लिज म्युट गर्नु न हजुरको
रानीजीको
Yeah,
पनि
boy.
You keep going. I'll sort it out.
ओके हाम्रो प्रकाश सरले भन्दै हुनुहुन्थ्यो यो हाम्रो डिस्कसनको कुरा छ है अब हामीले इम्प्लिमेन्टेसन फेजमा जब हस्पिटल लेभलमा जान्छौँ भने हामीले टाइमिङको कुराहरू आउँछ एउटा कुरो अर्को कुरो चाहिँ नि त्यो हामीले कसले गर्ने त त्यो जुन मोड्युल्सहरू छ कसले इन्ट्रोड्युस गर्ने बिचबिचमा केही प्रब्लम भयो भने कसले गरिदिने टाइम किपिङ कसरी गर्ने कहाँ केही प्रब्लम त्यस्तो लागिरहेछ भने हामीले स्टार्ट गर्ने बेलामा भने त्यो कुराहरू डिस्कस गर्नको लागि हामीले राखेको हो हामी जहिले पनि हुन्छौँ त्यहाँ जहाँनिर प्रब्लम हुन्छ त्यहाँ गएर सर्ट आउट गर्छौँ तर कोही त्यस्तो खालको अहिले प्रब्लम ओभरसी गर्नु भएछ अथवा केही हामीले गर्न सकेका छैनौँ कुनै हस्पिटलमा भने त्यसरी हामीलाई चाहिँ अलिकति इन्फर्म गरिदिनु भए अथवा डिस्कस गर्नु भएको भए हुन्थ्यो अर्को मेरो रिक्वेस्ट जहाँ जतिजना हाम्रो आउनु भएछ च्याम्पियन साहबहरू आफ्नो अनुहार एकचोटि देखाइदिनुहोस् र नाम भनिदिनुहोस् किनभने फर्मली हामीले यो मिटिङमा इन्ट्रोडक्सन भएको रहेछ त्यो भए त कमसेकम हो अनुहार दे उदय डाक्टर साहबको अनुहार हेर्दैछु म
नमस्कार सर
उदय डाक्टर साहब
चन्द्रिका
अलि केही भनिदिनुहोस् आफ्नो इन्ट्रोडक्सन भनिदिनुहोस् सिस्टर र तपाईँ मिलेर तीबाट सुरु गर्नुहोस्
नमस्कार
उदय डाक्टर साहब क्यान यु हियर मी उदय हो
आई एम जलेश्वर
Oh, you are Chandrika.
Yes.
Adhikari, and you are from Jaleshwar. I remember you.
Yes, sir.
So you are all right? Any problem छ?
छैन सर त्यस्तो प्रब्लम मैले हिजो लुइस डाक्टर लुइस र लेहानासँग कुरा गरे कि उहाँलाई भनेको थिएँ ओरिएन्टेसन चाहियो एटलिस्ट सबै स्टाफहरूलाई ओरिएन्टेसन भयो भने मात्रै गर्न सजिलो हुन्छ अब किनभने हामी दुईजनाले मात्रै त अब सबै हुँदैन नि त एटलिस्ट ओरिएन्टेसन चाहिँ फर्स्टमा ओरिएन्टेसन गरौँ त्यसपछि चाहिँ हामीले पेडियाट्रिक वार्ड पनि स्टार्ट गरिसकेका छ उहाँहरूले हेरेर आउनुभयो अनि त्यो भएको भएर अनि मैले पहिला ओरिएन्टेसन गरौँ सबै प्यारामेडिक्स डक्टरलाई मैले भनेर हिजो कुरा गरेको थिएँ हुन्छ भनेर भन्नुभएको थियो त्यही हो ओरिएन्टेसन नभए पनि अलिकति त्यही हो गाह्रो भएको सर रेकर्डिङ रिपोर्टिङमा हामी कमी छौँ नि त सर मेन समस्या अब सबै कुरा त हजुरलाई थाहा नै छ
तपाईँकै हातमा छ यो रिपोर्टिङहरू जति जुन गरेछ हामीले धेरै मेहनत गरेका छौँ त्यो कुरो त नगरिकन तपाईँले गरेको कामको रिकग्निसन हुँदैन त्यो भएर द्याट विल हर्ज यु टु वर्क मोर एन्ड
गर्न खोज्दैछु सर गर्नलाई त रेकर्डिङ रिपोर्टिङ गरेर अलिकति म्यानेज त गर्दैछौँ अझै पनि 100% गर्नलाई चाहिँ हामीले अझै एमएसएसले एकदमै सपोर्ट भएको छ हामीलाई रेकर्डिङ रिपोर्टिङमा अझै पनि अब ओरिएन्टेसन भयो भने सजिलो हुन्छ
गुड Thank you very much. Lian, can you hear me?
Yes, I can.
Louis? Yeah, they want some sort of orientation. And what did you talk about the orientation in Jaleshwar? Can I know about that?
We talked about, yesterday we talked about starting the modular course and the first module, and we talked about that the first presentation of the first module is a presentation about the program. It's the presentation that you did from the intensive ETAT course. And then we talked about introducing the triage teaching and who would be important to attend.
Okay, fine. So the first lecture will include the orientation as well, I think.
Yes.
If I am okay, thank you. Yes. Thank you very much. अब बर्दी बासबाट पनि हेरिरहेको छु हाम्रो उदय डाक्टर साहब Uday Dad sir, can you hear me?
Namaste. Yes sir, yes sir, I can hear you.
Yes. Your reaction on Nepali अंग्रेजी जेमा गरे नि हुन्छ
अहिले त हाम्रो ठिकै छ अब हामीले मिलेर गरिरहेका छौं हामीले अहिले चाहिँ अब इन्डोर फेसिलिटी छैन हामीसँग आउटडोर ओपीडी बेसिसमै केसहरु हेरिरहेको छौं ER-मा चाहिँ केसहरू आइरहन्छ। अब आजको जुन एउटा मोडल छ त्यो चाहिँ मलाई राम्रै लाग्यो। अब हस्पिटलमा पनि आएर सबै अब स्टाफहरूलाई, प्यारामेडिक्स, नर्सिङ डक्टर्सहरूलाई पनि यो एउटा जानकारी दिन पर्यो। एउटा चाहिँ राम्रै प्रोसेस हुन्छ ट्रिटमेन्टको र म्यानेजमेन्टको प्रोसेसमा। सबैले सबै कुरा थाहा हुँदैन, एउटा रिभिजन पनि त्यो मलाई चाहिँ लागु होस् भन्ने हाम्रो पनि आशा छ।
थ्याङ्क यू रानी खातुन डाक्टर साहब, रानी खातुनजीलाई हेर्दैछु म। Can you say something? Namaste.
Hi, Baliram.
Yes, sir.
Hello, sir. How are you?
Not too bad. Not good to see you and good to see Rani. Thank you so much. I'm sorry, I'm in the clinic, so I got in between.
So happy to see you.
Lovely, sorry. Thanks. Hi, Marcus. I'm in the clinic. I thought if I join in.
No, you carry on. You're doing some work, Arvind.
I'm doing some work. Here you go. I'm doing some work. Thank you.
Good.
Hi, Rani.
Hi.
Say something. How do you feel this program and how are going to do it? Nepali, Angrezi, जुनमा पनि।
म हिन्दी पनि बोल्छु, इङ्ग्लिस पनि अलिअलि बोलिहाल्छु, अनि म्याथली पनि बोल्छु, नेपाली पनि बोल्छु।
हामी सबै बोल्छौँ।
उहाँ सर अहिले चाहिँ कनेक्ट हुनुभयो नि।
हजुर।
अनि हैन के उहाँबाट आएर त एकदम इम्प्रुभ भएछ के। हामी चाहिँ धेरै सिकेको छौँ। पहिला त्यति आइडिया थिएन, बुझ्न त सबै बुझिरहेको छु त, फर्काउन के स्पिकिङमा चाहिँ अलि मिस्टेक हुन्छ मेरो, तै पनि एकदमै राम्रो छ। के भन्नु, त्यस्तै हो हाम्रो पनि। हस्पिटलमा एकदमै डक्टरहरू बिजी हुनुहुन्छ, ओटीहरू हुन्छ, डक्टर गौतम उतै बिजी हुनुहुन्छ, इमर्जेन्सीमा पनि हेर्नुहुन्छ, चारैतिर डक्टर गौतम हेर्नुहुन्छ। अनि त्यही भएर उहाँलाई भ्याएन, अनि मैले जोइन गरेको छु।
ठीक छ गौतम, थ्याङ्क यू भेरी मच फर इन्थुजियाज्म। र हाम्रो गौतम डाक्टर साहब,
त्यही डक्टर गौतम चाहिँ भ्याएन।
ए अर्को गौतम डाक्टर साहबलाई भन्छु, गौतम प्रसाद मण्डल डाक्टर साहब।
ए
लाहान मण्डल डाक्टर साहब, गौतम प्रसाद मण्डल डाक्टर साहब।
सर नमस्ते।
नमस्ते
सर, हामी चाहिँ ड्यासबोर्ड चाहिँ मेन्टेन गरिरहेछौँ। अस्ति चाहिँ उहाँहरू आउनुभएको थियो, अनि त्यो विकली 4 डेज विकली हो कि अब 4 डेज कन्टिन्यू हो। उहाँहरूले अब त्यो प्यारामेडिक्सहरूलाई ट्रेनिङको लागि एरेन्ज गरिदिनु भन्नुभएको थियो होइन। त्यो चाहिँ हामी चाहिँ प्रिपेयर गरिरहेछौँ। त्यो भयो भने हाम्रो अझै राम्रो हुन्छ। इट्याटमा
अहिले भर्खर हजुर हजुर। अब अहिलेको जुन मोडुलर ट्रेनिङ छ त तपाईहरु पनि च्याम्पियनहरुले दिने ट्रेनिङ हो यो, र प्लस हामी इन्फोर्समेन्ट गर्छौं जिएलएमहरुले मिलेर है। त्यही भएर तपाईहरुको त्यहाँको इन्भाइरोमेन्ट प्रिपेयर गर्नुपर्ने भयो। त्यो सब गराइदिनु भएकोमा धेरै हामी खुसी हुन्छौं है। धन्यवाद। अरु केही छ, केही प्रब्लम छ त्यहाँ? छैन?
अहिले ठीक छ सर, अहिले केही छैन। जस्ट यो नेक्स्ट अब ट्रेनिङ भयो भने प्यारामेडिक्सहरुलाई हाम्रो हस्पिटलबाट पनि मलाई पनि अलि सजिलो हुन्छ।
ल ठीक छ। प्यारामेडिक्स नर्सिङ स्टाफ हजुर, डाक्टर साहबहरु सबै पिडियाट्रिक्ससँग रिलेटेड सबैलाई। जीवन जयन्ती जी, जीवन जयन्ती जीलाई पनि एकचोटी सुनौ। अलिकति अनम्युट गर्नुस्, अनम्युट गर्नुस्।
सर नमस्ते सबैजनालाई।
नमस्ते।
सबैजना सन्चै हुनुहुन्छ होला? मैले ढिलो जोइन गरेँ, नाइट ड्युटी थियो, आएर सुतेपछि ढिलो उठेँ। सर एक्चुअली हाम्रोमा राम्रो भइराखेको छ होइन। जस्तो अस्तिको इटा ट्रेनिङले गर्दाखेरि एकदमै बेनिफिसियल भएको छ। र अर्को कुरा, हाम्रो लियन र डाक्टर लुइस आउनु भएको थियो। हामीले प्यारामेडिक्स नर्सिङ स्टाफ ओभरअल सबै स्टाफलाई इट्याटमा ट्रेन गर्ने भन्ने कुरा थियो। अनि यसमा चाहिँ हाम्रो डाक्टर नागेन्द्र केही कारणले बाहिर हुनुहुन्छ, उहाँ हुनुहुन्न, उहाँसँग कोर्डिनेट गरेर यहाँ क्लास एरेन्ज गर्ने भनेर प्लान गरेको। अनि उहाँ केही कारणले बाहिरै हुनुहुन्छ अहिले। अनि त्यो कसरी एरेन्ज गर्ने भन्ने कुरामा चाहिँ अलिकति गाह्रो भइरहेछ मलाई।
ल कुनैको डिफिकल्टी छ भने लेट अस शेयर विथ अस। हामी जहाँ हामी ट्राई गर्छौँ, कुनै पनि केही डिफिकल्टी छ भने हामी टिम मिलेर तपाईँलाई, हाम्रो निराला जी हुनुहुन्छ, निराला जी इज भेरी एक्टिभ है, त्यहाँ गएर सर्ट आउट गर्नुहुन्छ, नभए वी आर आल्सो हियर टु सर्ट इट आउट।
सर म एउटा थोरै कुरा सेयर गर्छु। जस्तो हाम्रो ट्युजडे सिएमई क्लास हुन्छ, हाम्रो कन्फरेन्स हुन्छ होइन, र यो 2-2.5 घन्टाको भने सेलेक्टेड पर्सनलाई त्यहाँ राखेर मैले मेरो लेभलबाट गर्न सक्ने र सरको पर्मिसनबाट गर्न सक्ने भनेको एउटा त्यो वे हेरेको छु। मैले सरसँग सेयर गर्न पाएको छैन, हाम्रो डाक्टर साहबसँग। अनि एउटा त्यो पोसिबिलिटी छ, र अर्को अब केही पोसिबिलिटी छ भने सरसँग भेटेरै कुरो डिस्कस गर्नुपर्छ होला, र त्यो कसरी गर्न सकिन्छ म हजुरहरूलाई जानकारी गराउँछु।
हुन्छ हुन्छ, त्यसो भए हाम्रो अब को बाँकी भन्नुभयो, अरूको देख्दै हुन्छु म। अब चन्द्रिका अधिकारी जी कुरा भयो। चन्द्रिका अधिकारी भइसक्यो। ल पिङ्की जी, पिङ्की शाह, पिङ्की शाह।
सर नमस्ते सर।
नमस्ते, अलि अनुहार पनि देखाउनुहोस्। अनम्युट गर्नु पर्यो।
How are you, sir?
I'm fine. Not hot weather like in Nepal.
अरूको हुनुहुन्छ सम्झना जी। सम्झना त्यसपछि लता देवी बज्राचार्य, सागर खोइ सम्झना जी सुन्दै हुनुहुन्छ?
नमस्ते बालिराम डाक्टर साहब, नमस्ते।
हजुर नमस्ते, के छ हालचाल? ठिक छ?
हजुर म पनि एउटा अर्को प्रोग्राममा थिएँ। मैले त्यो 4 बजेको नोटिफिकेसन ठ्याक्कै मिस गरेछु कि भर्खरै मैले अहिले बाटोबाटै जोइन गरेको छु। मैले सुनिरहेको थिएँ हाम्रो साथीहरूले, हस्पिटलको साथीहरूले बोल्नु भएको, एकदम राम्रो उहाँहरूको सेयरिङ भइरहेछ। थ्याङ्क यू डाक्टर साहब, म चाहिँ अहिले कन्टिन्युअसली जोइन गरिरहेको छु।
हजुर, थ्याङ्क यू सो मच फर जोइनिङ अस। थ्याङ्क यू सो मच। अनि अरू कहाँ कोही बाँकी हुनुहुन्छ? कोही अरू हाम्रो च्याम्पियनहरूबाट?
या सुभद्रा जी फ्रम नारायणी हस्पिटल।
ओके सुभद्रा जी।
हजुर अनम्युट, हजुरको भोइस आइरहेको छैन म्याम।
नमस्ते म्याम। हाम्रोमा चाहिँ जस इट्याट ट्रेनिङ पछि चाहिँ हामीलाई अलिकति के भन्छ त्यो मोनिटरिङमा त खासै प्रब्लम होइन। मेन हाम्रो प्रब्लम भनेको ट्राइजमा थियो। त्यो चाहिँ जस हाम्रो जिएलएमएस हुनुहुन्छ नि, उहाँहरूसँग कोअर्डिनेट गरेर हामीले चाहिँ ट्राइजको ओरिएन्टेसन जस्ट इमर्जेन्सीको स्टाफ र पिडियाट्रिक वार्ड र के भन्छ तपाईँको एनआरएसको स्टाफलाई ओरिएन्टेसन दुई हप्तामा आधी गरेर ओरिएन्टेसन दियौँ। त्यसपछि अहिले चाहिँ अर्को जुन इट्याटको चाहिँ अब आई थिङ्क हामीले चाहिँ जुन 20 देखि सुरु गर्ने भनेका छौँ। त्यसमा चाहिँ खासै केही प्रब्लम छैन। बिचमा केही प्रब्लम भए चाहिँ हामी डाक्टर फियोनासँग कन्सल्ट गरिहाल्छौँ। अरू त खासै केही छैन।
खासै छैन। तयार हुनुहुन्छ मोडुलर ट्रेनिङको लागि? अब
हजुर सर,
तपाईहरु हामीले तपाईलाई ट्रेनिङ दियौ and you have to impart the training to all your colleagues over there, subordinate, maybe some डाक्टर्सहरु पनि हुनुहुन्छ, सिनियरहरुलाई पनि दिनुपर्ने हो ट्रेनिङ दिएर रेडी भएर बस्नु पर्यो है।
सिनियर हामीलाई चाहिँ अब डाक्टर शैलेशले ह्यान्डल गर्नुहुन्छ।
ठीक छ, शैलेश डाक्टर साहब आउनु भएको छ?
अहिले सायद जोइन हुनुहुन्न
उहाँ हुनुहुन्न। हजुर उहाँ हुनुहुन्न।
अच्छा ठीक छ। अरु कोही बाँकी हुनुभयो निराला जी?
हजुर कलैया हस्पिटलबाट सागर जी केही भन्न चाहनुहुन्छ? हजुर
कलैया
सबै कुरा ठिक चलिरहेको छ अस्तिको उसमा त झन् सबैजना एक्टिभ भएर काम गरिरहेको छ हेलो
निर्मला दी
हजुर सागर जी
अरे सुनिए ना, अलि जोड ले।
अलि सुनिए ना हजुर।
हेलो म्याम, म के भन्दै थिएँ कि अस्तिको ट्रेनिङबाट त सबजना एकदम एक्टिभ भएर काम गरिराख्नु भयो त, त्यही भन्दै थिएँ म्याम। जो त्यो ट्रेनिङ चाहिँ हाम्रो राम्रै भयो भएर सबैजना एक्टिभ भएर पहिला त जो ट्याच हामी अप्लाई गरिरहेको थियौँ तर पनि अहिले चाहिँ अलि फुल्ली एक्टिभ भएर सबैजना लागि पर्नु भयो।
थ्याङ्क यू।
ल कुनै थ्याङ्क यू। ल अरु कोही बाँकी हुनुभयो?
रेडमीबाट को हुनुहुन्छ? रेडमी नोट 9 प्रोबाट कुन हस्पिटलबाट हुनुहुन्छ? रेडमी नाइट प्रोबाट। ए हजुर ए
हेरेको अनि त्यही भएर
ए हस् हस् हुन्छ। सो भयो
कुरा भयो पिंकी जी सँग
भयो भयो।
अच्छा ठीक छ। अंजलि
अंजलिसँग रिप्रेजेन्टेटिभ हाम्रो डाक्टर गौतमले गरिसक्नु भयो, त्यो भएर हजुर। नत्र अंजलि जी हजुरलाई हजुर हजुर केही एड गर्नु मन छ अंजलि जी हजुरलाई? अंजलि जी I think it's
okay. So we have been some interaction. This is just introductory interaction. Most of them are very enthusiastic and they want to do the program. With some difficulties, there has been a little bit of difficulties in losing some of our champions. So we have arranged for that. And in 2 or 3 hospitals, we have arranged alternate champion as well. Nirala has been doing quite good work. She has been persuading them, and so I think we are ready. We are ready for that. Any comment from Dr. Prakash, Dr. Joshi, Dr. Prakash?
Hello. Okay.
Hello, sir.
Nothing special. It's going fine. Nice to hear that everybody is enthusiastic and everybody is willing to run it at their maximum capacity. That is good. And beyond that, what we can guess, what we can see from here is that Fiona, Luis, and Liana, they are doing beautiful work that everybody is convinced to work hard. That is the beautiful thing. All right. And regarding these modules and feedback, shall I take this opportunity to say something regarding that feedback?
Sure.
Okay, especially earlier, I think I was in touch with Lucy. She has left, and Lucy, Fiona, and myself, we are having conversation through mail, isn't it? And some of the update has been delivered in mail. I think Fiona is well aware of it. Regarding oxygen, let me clarify here. In pneumonia part, the SpO2 level less than 90% has been upgraded to less than 92%. I think Lucy agreed about it, and we discussed about it in NEPAS also. I also talked about in NEPAS our executive meeting and academic meeting. And though the WHO has said it's up to 90%, it was long back. Now after COVID era, it seems that below 92 you need to give oxygen. So in that part, we have to upgrade it to 92. Yesterday I went through it, it is still 90. Okay, and the other in asthma part, yes, I think Bhanu has commented it regarding SABA. I have written it short-acting beta agonist. Instead of that, you can put SABA as well.
Prakash, can I make comment on that? I think just watch. Sure. I think the issue about oral bronchodilatation
as well.
Yeah, that come, and I think, I don't know, maybe there's difficulty in availability, but I'm just making my point that I don't know how effective that is. And we are, of course, the situation in England is different, but we are not using for last 20 years. So just a point to consider for options. Of course, we stopped using theophylline and things because of gastric irritation. But the options are limited.
Theophylline has been out of stock right now.
Okay, yeah. So I don't know what the options
regarding
are.
Salbutamol, oral salbutamol, it's
So need to consider options or
regarding
whatever.
oral salbutamol, WHO protocol itself has said, we can omit it as well.
No, I want
if you have,
all of your
if you have nebulization facility.
No. So I think I want point of view from all yourself and local to see what is the best option or that is only option. But I'm just flagging it up as a physician from here, which is I don't know how effective it is. Yeah, that's fine.
Yeah, one thing.
We'll go through it and let you know.
But what practically we see that oral preparations are quite freely available in Nepal and India, and people are using it very frequently. It is effective as well because we have also used that oral preparations. But I don't know whether to include in our program or not. This has to be decided after consultation with our experts. But this is available in Nepal.
Basically, we cannot differentiate clinically pneumonia, bronchiolitis, and blah blah. All the things, more or less, they present with the similar symptoms. Many a times, even low respiratory tract infections, whatever you say, pneumonia is also associated with little bit of wheeze. So many a times they use the term wheezy LRTI. Even in Kathmandu also, some of the physicians, they prefer to use word wheezy LRTI rather than pneumonia only. So in that case, if you give bronchodilator, it helps according to their,
Okay, I'll wade in here.
Sorry. Yeah.
I mean, BTS, NICE and stuff our end has said that if you can hear wheeze, then generally that means that a bacterial infection is very unlikely. Now, having worked in Africa, again, this is slightly more blurred, but on the whole, I thought worldwide, if you can hear bilateral wheeze, it means that a bacterial infection is less likely. And whilst I completely agree, therefore, that we should be thinking about bronchodilators, I think with the global thrust to reducing antibiotics, I am worried about putting everything in the same group. I also share the worry about oral salbutamol. Oral salbutamol, like you, was swirled around all the time. Everyone used it until I thought that the evidence now is that oral salbutamol is not very useful. And obviously, you guys can talk that through, but just because everyone's using it doesn't mean to say that it's great stuff. I mean, I've spent decades of my life using stuff which has then proven to not be very good, and now I stopped. So I think we probably do need to, it's your opinions, it's your call. But I do think that blurring the lines between wheeze, viral illnesses and bacterial illness is tricky. And I think using oral salbutamol is also tricky. But this is probably too much detail for this meeting. I apologize to Marcus. Us respiratory people should go on.
Good to have a chat.
Can I just double check something, Dr. Prakash? It's 92 for everything apart from asthma. Asthma is still 94. Start oxygen when saturations are under 94 in asthma. Oh, sorry, you're muted.
Sorry. In asthma, it should be maintained above, below 94.
Oh, 94, perfect.
Yes.
Just wanted to check.
Yes.
Sorry, I changed the handbook, but I didn't change the lecture.
Pneumonia, yes, in pneumonia flowchart, there it is written 90. It should be 92, less than 92.
Is that on the lectures that you've seen that?
Pneumonia.
Where was that you seen that? Just so I can find that. Was that the lectures?
Flowchart. In pneumonia, severe pneumonia flowchart.
Inside the modular lectures?
No, lecture. It's the flowchart. There is, algorithm.
I'll have a look and find it on the standard.
Yeah.
Okay, I'll have a look and change it.
Otherwise, I will send you it.
Perfect. Thank you.
I will mail it later.
Thanks very much.
Okay.
Dr.
Now
Prakash.
let's hear from our GLM. Let's hear from our GLM also. What has been the experience like in the field? They have been going in very hot weather. What has been done so far and how they feel now? GLM.
Okay, can I start? So,
yes.
I've really enjoyed being here so far. It's been really amazing experience. I do find that the temperature is a bit hot, but I'm sure it'll change throughout the year. But I'm really enjoying it. Everyone's been very welcoming. We've been very welcomed in the hospitals. Everyone's been very enthusiastic. And I'm pleased to carry on working here for another 6 months.
Hi, Luis.
Thank you. How about Liam?
Thank you so much for working with us for the last few weeks. It's been exciting. We've already made some progress, and I'm here until March, so I'm quite excited to see what we can do together and get our modular course going next week. I think once we get the modular course out, that it'll really engage all the staff in your hospitals as well and help to improve pediatric care. Looking forward to working with you all some more.
Thank you.
I just
Fiona, what did you say?
I just said I echo everything the other two have said. It's been really good so far. Thank you for being so welcoming. And I'm here till January, so quite a long time to do lots of things together.
I feel.
Good. Now anybody left for the comment? Nepali colleagues or maybe? Over to you, Marcus, now.
Great. Well, thank you very much, everyone. That's been a fantastic meeting and we've covered lots. And we are all looking forward to continuing to work together. So thanks very much, everyone. That's been a great meeting and we'll meet again soon.
Sure.
Great.
Thank you. Bye, Fiona, Luis.
Take care.
Luis, bye, and bye-bye.
Thank you.
Bye-bye, Jerome. Bye.
Thank you.
Bye, Arvind.
Bye, bye, Madam.
Bye.